cracking NEET and wearing the white coat, the dream we grow up. एक बार NEET crack कर लो, आगे life set. Opening YouTube and searching for MBBS life opens up with family adoption program, clinical duties, college trips, college function, and a lot of enjoyment. But nobody shows you what actually goes inside. Hello friends, this is Soumya Saraswat, final year MBBS student at SGMCH Puri, and today I will show you the backstage of MBBS life which nobody shows. If you are an aspirant, then this video is not for you. Because one thing you have to remember, crying in MBBS is far better than crying for MBBS. So starting with topic 1, exams in MBBS. We medicos don't have any semester exam. There are 2 or 3 internals in a year which we usually take it as a mock test because it has no value in the final report cards. Then you must be thinking, पूरे साल only enjoyment, no पढ़ाई. Really? Here comes the catch. To sit in the final medical board examination, you have to at least qualify 2 of the 3 internals which are conducted in a year. Sounds easy, right? Let's get a little bit deep inside. The passing criteria for MBBS is 50%, not 33%, which is usually in 10th or 12th board. To make it more clear, I will share with you the days of MBBS exam. This is the routine of 90% of students, irrespective of whether they have prepared for the whole year or starting just 1 month before exams. As the exams get closer, the hostel turns into a silent library. We wake up, brush, have breakfast and sit to study. Again, we have lunch and sit to study. Then we have dinner, talk with parents for 5 to 10 minutes and again sit for study. And some students stay awakened even for whole night. On exam days, talking about internal, we wake up at 3 or 4 am, study till 9 am and go for exams at 10 am, attend exams for 10 am to 1 pm and after 1 pm we have our lunch and then take 2 or 3 hours rest, most probably we sleep and then prepare for the next day exam. You guessed it right, there is no gaps between the internals. It's not about how much you have read before the exam because MBBS is the most top course in India. So revising all topics before exam is really tough. Coming to topic 2, the hectic life. Often in YouTube, we show you the 10% of the time where we enjoy. Rest everyday life is a black and white film. At 9 am, go for clinical duty and come back to hostel at 1 pm. For 1 to 2 pm, we have our lunch and again at 2 pm, we go to the college to attend our class because 75% attendance is also a necessity to appear the medical board exam. At 5 pm, when our classes are over, sometimes we go for outdoor games and the other day, the dehydrated and exhausted body just seeks for rest. Then hardly getting 2 to 3 hours for study and then going for sleep. Is it really so bad? Perhaps no. When you start enjoying your daily life, this schedule becomes quite interesting as you get family adoption program, exhibitions, quiz and college functions. Do you remember that one friend who always supported you, always hold your back through thin and thick? You are hardly going to get such a friend in medical college. Let's know why. Topic 3, toxicity. Here everyone is crazy, outperforming the other. We live in a hostel where we interact with our competitors. Running in the rat race overshadows emotions. Here more than friendship, we boost our greed and selfishness. People talk with you for their profit, make friends for their profit, care for you for their bitter but truth. Once you vanish from the college, nobody is going to think of you even for once. पर हमें क्या, हमें तो कोर्स खत्म करके जॉब के लिए फोकस करना. एंड हियर कम्स द नेक्स्ट टॉपिक, जॉब्स आफ्टर MBBS. After MBBS, you have 2 options. Either you have to prepare for NEET PG or you get a government job as a doctor. You can also perform both of these, but you have to qualify a government exam. In Odisha, it is OPSC to get a government job, and then you can prepare for PG, or you can directly take drop and prepare for PG. It's a dilemma between money and करियर. वीडियो में आगे बढ़ने से पहले वीडियो अच्छा लग रहा हो तो वीडियो पे एक लाइक दबाइए एंड चैनल को सब्सक्राइब कीजिए ऐसे कंटेंट के. इन द नॉर्मल गवर्नमेंट जॉब विदाउट PG एंड गेट ए सैलरी व्हिच मोस्ट पीपल फील इज लेस टू द एफर्ट्स यू पुट फॉर योर वर्क. सो इज इट रियली बैड? एब्सोल्युटली नॉट. Medicine is not only about making money. Think of treating an old lady not able to walk properly, and in a rural PSC taps your head with blessing. भाई blessing से घर नहीं चल. Yes, true. But as a doctor, you will always have sufficient to live a balanced life. For a luxurious life, you have to grind even after MBBS. So MBBS कर लिया तो life सेट नहीं, लेकिन लाइफ सेट होने के लिए मल्टीपल दरवाजे खुल जाते. भैया फ्यूचर के बारे में बहुत ज्यादा हो. ओके, थोड़ा पास्ट के बारे में भी बात कर देते हैं. सो नेक्स्ट टॉपिक, MBBS जर्नी. Hardly 1 to 5% of the freshers crack NEET. Else, most of the students are 1 to 2 years dropper in a medical. Medical profession and studies are a never-ending process. So, in long term, you will perform good only if you love this profession. This profession will ask you for sacrifice, and it's worth it because saving a life is worth. But have a roadmap in your mind. NEET, MBBS, internship, NEET PG, residency, super specialization which is optional. So as we have discussed the major points, we have reached a stage in the video where we have to conclude this video. MBBS is a never ending study process filled with toxic environment, heavy workload, low paid jobs, deteriorating social life, and sometimes a frustrating leave everything feeling. But at the end, you are reducing pain, healing diseases, giving relief, and saving a life. It is much more than money. You are getting a social recognition which no other professional get. If you are only for money here, then you may get halted in the middle. But if you love it, come and enjoy the journey of MBBS.